looks like you're here for the plastic surgery. How can I tell? Well, you know, just by looking at you, I can see that you're definitely not here for the doctor, but just these things that are pretty wrong with you. I just passed my shelf on the face. That's okay. All right, let me start by just doing a general analysis, because I can see I need to do... Okay, no, it's okay. Shh. I'm gonna determine what's necessary. That's how we work here in my practice. That's the best thing. You can trust me. I have been doing this for ages. All right, let me just kind of get a measurement, a brief, very structured, just an analysis, just with my fingers and my eyes, like that. Just let me feel. Okay, I feel the bones here. The bones here are a little bit more slanted than here. Yeah, have you been chewing more on that side? It has strengthened your bones there. Yeah, definitely. Hold on one second. I'm just going to be pressing, and you have to tell me if this hurts. It hurts. I thought so. It's overdeveloped. Your masseters. And here. Does that hurt? And there. Okay, and what about here? Does this hurt? Here? 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 You hear how that's more hollow sounding? That's your bone that's breaking down. Your face gonna get very asymmetrical. It's already like that, so that's what I'm gonna fix. I need to draw for certain things. I'm just gonna start drawing here. I'm going to do both sides, just to make sure that it's you know, symmetrical. So I'm gonna make something new. Yeah, I know that one side is good technically, but I'm gonna make it even better. There, that's good. That's perfect. That's perfect. Can you look here? Look here. Look here. Just taking a look. Just taking a look. Shh. I'm just gonna see how your stress response is. Okay, can you now look here? Just trying to take a look. Can you follow my fingers? Can you keep following them? Okay, and now again here. Okay, good. We are doing good. I'm just going to do a little bit of test. I'm just going to see how your skin responds before we start cutting and like dragging and stuff like that. I'm just gonna pull it a little bit. Just seeing how the skin responds to my touch and to my pulse. Okay. We just want to make sure that you're strong enough to handle this, because else you're going to keep bleeding and bleeding. And that's not good. Okay, let me just... Okay, this sounds pretty good. Good. Okay, the skin. Tiny bit red here, tiny bit red over here. Have you gotten a nose job before? That's kind of botched. Okay, your nose does look like it's botched, but I believe you. That's your natural nose. I believe you. That's not insulting. That's called telling the truth. I don't lie. It's actually good quality not to lie. It's admired in humans, so... Shh, you talk too much. You talk way too much. Like, take an example of me and just be more professional, okay? Okay, I'm just going to do... Pulling that again. And then here. Do you in general like to be more snatched or kind of like rounded? Some people like that rounded face. You know, I think it's cute. Okay. No, I don't agree. I'm going to do something else. Okay, I'm just going to now test you with this thing because it's going to see how you respond to a more prickly touch. Right there. You're going to need a few surgeries, so I actually wanted to suggest you the discount card. You get 10% off from 2 surgeries. You get 20% off when you do 4 surgeries. So, and if you do them all at once, you get 50% off when you book 4 at once. You feel that? Feel that? What do you mean if that's legal? Would I be doing it if it was illegal? You feel that? Feel this? I think you, yes. If you ask me, I think you do need it. And you're asking a professional here, so I would book 4. First of all, I'm going to shave down the jawline a little bit. Okay. I'm going to shave down the jawline. Then we are going to, hold on. I'm going to get my stuff. We're just going to do a basic drawing of this. Okay, I'm just going to see. I'm going to just draw your face out like that. Okay, we're doing the Joe. And we're going to just be pulling that a little bit just to make this a little bit more snatched. Shaving and pulling. Shaving and pulling. We're gonna, your eyes look a little bit droopy. We want them to go upwards. Yours goes kind of like downwards, you know? We're going to pull that up because you look sad. Have you been sad? You've been sad a lot. Well, I'm sorry about that, but we have no time for that. Okay, let me see. Yeah, definitely gonna do that. So that's 2 surgeries. We are going to do a little bit, maybe your nose right here can be a little bit thinner, so we're gonna shave that down the nose. And just your hairline, gonna pull that down a little. You have a very abnormally large forehead. It's beautiful to have a large forehead, but not too large, if you know what I mean. It looks like you're balding. Okay, good. So I've got it all. Perfect. Let me do just a few measurements just for your eyes' sake. If I come close and I just put it here, and I'm just going to see how much there. And if I do it slanted like that, we can go this way like that. Good. And if we do the other eye, we are gonna do it. There. Okay. Yeah, I think that's good. Now your hairline, I'm just going to where's my sponge? Okay, good. I'm just going to, let's see, I'm just gonna drag that down and then here like that. We're gonna just do a rounded shape. Forget about heart shape and all of that stuff. We don't need that. It's gonna take me too much time. And then your nose, I'm just gonna do your nose here and there. Just like that, just a little bit thinner. Good. I think we're good to go. I'm just going to do a little bit of brushing. See how sensitive you are. If you can feel this most sensitive brushing, can you feel that? 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 Good. Good. All right, let me see. I'm going to start with shaving down the side of your face first. I want you to look at these. Just is a form of anesthesia that we use to make the patient happy. So you just stare at them, you get all happy, and then we can start. No, we don't need to sedate you. This is enough. Just let the happiness hormones flow through your body. Good. Now we're gonna start. Okay, I'm just going to file. Just going through the skin and through the bone at once. Okay, Just let the happiness flow through you. Just let the happiness. Oh, we're gonna dab a little bit. Just a dab. Just a dab a little bit. Choo, 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 choo. Okay. Good. And then this side also a little. But not too much because that one is already underdeveloped. Good. Just dab a little bit. We're gonna suction away some blood. Here also. Okay, good. Some lip gloss. Relax. We got time. What do you mean it hurts? Okay, I know what you need. Is it hurting less? No? Focus. It's because you're not focusing. Focus on these sticks. Good. What do you mean? I'm just gonna drag it and pull it and then hook it into the skin in the back. There. Drag it and pull it in the skin in the back. Good. I'm gonna do the same here. Just drag it, and just hook it into the skin in the back. Drag it, and pull it in the skin. That looks good. It can feel a bit tight, like you can't open your mouth. It's incredibly normal. Okay, we're gonna just suction with this. Good. And suction with this. Good. Just relax. Enjoy the moment. Enjoy the experience. Okay, I'm just going to do the nose now. It's almost done. Good, that's shaved enough. I'm just going to test if you still have, all your senses. Feel that? You feel this? You don't feel it. This? You don't feel it? Well, that's completely normal. That's completely normal from these procedures. What if I do this? You don't feel that? Okay, that's good. Actually, that's good because you won't feel pain then. Actually, that's a good thing. Okay, now I'm just going to pull that on the side of your eye. Just gonna do the... okay, good. Just sit, relax. Relax and sit still. Good. Yeah, kind of good. There we go. And then here, just kind of, just like dragging that like that. I know it can be. Just try and lay still if you can, because you're wiggling so much. Like, good. You're wiggling way too much. You're wiggling way too much. Lay there. Sit still. Okay, good. Okay, let me just suction that again. Just. Okay, and then just like here, I'm just gonna suction. Good. Excellent. Let me just see if that's a little bit symmetrical. If you can go like that and see 0.6 or 0.8. Kind of good. Now we're gonna do the same thing, but focus on the sticks. Focus on the sticks. Good. I don't care if you say good or not. I say good. And I say good because it's good. Okay. I'm just dragging that down a bit. It's almost over. Why are you whining when it's almost over? Shh. Think about the 50% off. It's gonna get you through. That's gonna get you through. Yes, it will. You don't have a very flexible scalp skin, right? Do you know that? People can move their scalp usually. You can't. Trying to drag it down. It's gonna. Okay. Emergency. Okay, we couldn't do that. We're gonna do something else. We're gonna do hair transplants. Give me your arm. Okay, I just epilated some hairs of your arm. I know it hurts a little bit. Your arm, you have a lot of hair on your arms. We're gonna implant those. Okay, I'm gonna implant those one by one. They're putting them there, and just gonna take some chook and just whoop. Chook. One by one. I'm gonna implant those here. No, they actually, once they're implanted into the skin, they start becoming like head hairs. They will not be like your arm hairs anymore. No. Did you know that? I could use your pubic hair and it will become a head hair. Okay, fine, whatever. You're too scared for all of this. Why do you come to the plastic surgeon when you're so scared? What do you mean you came for the dentist? Too bad. You do need a dentist as well. Maybe next time, actually, if you do a dental procedure plus the plastic surgery procedures, you actually get 60% off. Should have told you that before, but you know, next time we can do some more, and then you also do your teeth, and then you'll be saving tons of money actually. There. Let me just suction. Yeah, there is a little bit. Wait, let me use my other one. It's a bit better. Okay, how does this feel? How does this feel? And this? And this? It hurts. Okay, it's kind of good that this hurts, but this does not hurt. Do you already feel it or not? It's okay. Hold on a second. I'm just cutting your hair a bit so it doesn't look out of, you know, it's just this short, weird hairs in there, and then the rest is long. We can't have that. We're gonna cut the entire thing so it all looks the same. Shh, you came here for the experience of a lifetime, and I'm giving you that. You'll thank me later. Maybe not in a month, maybe not in a year, but eventually you'll come to grow up, you know, mentally, and understand why everything happens for a reason. There, that's good enough. I have another patient, so okay, let me see. Okay, and that will be let me just calculate that. Where is my pencil? Where the heck is my pencil? You stole it? You stole my pencil? You stole my pencil. Here it is. I knew it was in your pocket. Okay, we are going to do that, and then you are getting 40%. 50%. What was it? 40, 50? Oh yeah. Okay, that will be $65,000. We can do that in installments, okay?